Hi guys, welcome back to my YouTube channel. My name is Edidio Udoiko, and on this channel I give you health and wellness tips. If you are seeing my video for the first time, please subscribe, click on the notification bell, and if it is not too much to ask, please can you watch the video to at least half, please. When you do this, the algorithm assumes that you like my videos and push my videos to a larger audience. I mean, like, imagine more people getting to benefit and learn from what you've just heard. So please, if it's not too much to ask, please watch till at least half. First 3 minutes is fair. Thank you. So today I'll be talking to you about the most common form of diabetes. It's the most common and it's associated with lifestyle factors. So I'll be talking to you today about type 2 diabetes. Okay, type 2 diabetes is a condition where your body becomes resistant to insulin. Insulin is a hormone that is produced by your pancreas that helps to regulate blood sugar. So if your body becomes resistant to insulin, that means you get like very high spikes, frequent high spikes in your blood sugar levels rather. So this is what type 2 diabetes is. And in this video I'll be telling you causes and factors. So when we say causes of type 2 diabetes or factors that can predispose you to type 2 diabetes, one of such is age. If you're from 45 and above, you're predisposed to having type 2 diabetes. Yes, you're predisposed to having type 2 diabetes. Ethnicity too can predispose you to having type 2 diabetes. If you're African American, Hispanic / Latino, American Indian too. If you're from one of these ethnicities, yeah, you can be predisposed to type 2 diabetes. Also, if you're obese or overweight, you're predisposed to type 2 diabetes. If you also have history of type 2 diabetes or history of gestational diabetes, that's diabetes during pregnancy, or you've delivered a child over 9 pounds, that's for females, yeah, you are predisposed to having type 2 diabetes. Now, the good news is type 2 diabetes can be controlled and managed. You just have to do lifestyle changes. Like I told you, it's often associated with lifestyle. So you just have to do little tweaks in your lifestyle here and there, and you'll be fine. So like I said, obesity or being overweight can be a predisposing factor to type 2 diabetes. So there are ways you can manage diabetes. Like I said earlier, good news is it can be managed. So physical activity, taking walks, and any other physical activity or exercise that you engage in can actually control your type 2 diabetes, can manage it. Before I forget, I was going to tell you about the symptoms. The symptoms they can be mild but not unnoticed. They do not go unnoticed. The first one you notice if you have type 2 diabetes, mostly the first one you notice is frequent thirst and frequent urination, especially at night. Some people also experience weight loss. Some people lose weight. Some people also experience blood vision. Symptoms can vary. They may seem mild, but not unnoticeable. They do not go unnoticed. You may also notice that your wounds and cuts heal very slowly. If you have type 2 diabetes, this can happen to you. Also, if you feel like tingling and numbness in your hands, if you feel tingling and numbness in your hands and in your feet, you may have type 2 diabetes. These are things that you can do to control and manage type 2 diabetes. The first one is to eat healthy foods. Eat foods that are low in sugar and saturated fats. So this can really go a long way to controlling your blood sugar, yeah, and subsequently manage your type 2 diabetes. Exercising cannot be underemphasized. Exercise, take walks, try to lose weight, eat healthy, track your blood sugar. And then some people they do not know how to like monitor their blood sugar. If you're going to check your blood sugar, you should do it when you've not eaten. That's why it's called a fasting blood sugar test, when you haven't eaten. Because when you eat, especially foods that have like carbohydrates, yeah, that have little carbohydrates, it gives like this little spike in your blood sugar. So if you check your blood sugar at that time, your results may not be accurate. So you should check it maybe first thing in the morning when you wake. That's before you eat. You should also take your medications. That's you've actually gotten like diagnosed. You should take your medications and your follow-up hospital visits seriously. There are complications that can stem from mismanaged type 2 diabetes. The first one of these complications is heart disease and stroke. You know this thing they say about comorbid conditions, so it can degenerate and get there. You can get like heart disease and even a stroke if you have mismanaged diabetes. It can also lead to loss of vision. You can lose your sight from, I think I mentioned that blood vision is like a symptom. So you can actually lose your sight if you mismanage your type 2 diabetes. Another complication is nerve damage and subsequent amputation if you mismanage your type 2 diabetes. You can lose a limb from it. That's why you're supposed to like track your blood sugar, follow up on your hospital visits, yeah, track your blood sugar, eat healthy, exercise, and all of that, so you do not get one of these comorbid conditions. Type 2 diabetes, if mismanaged, can lead to heart disease and stroke. You can have like total loss of vision, like you can't see anymore. You can lose your vision. From blood vision, you can totally lose your vision, your sight rather. You can get nerve damage and have to like amputate one of your limbs. Yeah, you can have to amputate your limb if you've mismanaged, if you have mismanaged type 2, mismanaged or undiagnosed diabetes. So please, if you have type 2 diabetes, do well to do these things that I mentioned in this video. Yeah, follow up your medication, your hospital visits, track your blood sugar, try to eat healthy, and meals that are low in sugar and saturated fat. I wish you the best, the very best. Please, if you like this video, I have a little favor to ask of you. Please send it to your friends and leave in the comments what do you think about the video. I wish you the best and I'll see you next time. Bye.